Tell us how this has been feeling and where it's been hurting and what makes it worse.
Just what we just did made it worse.
The exam made it worse.
I cut 150 pieces of styrofoam, and that's when it started hurting. It's right about in here.
That's the spot. Okay, I'm going to put this on. And we didn't demonstrate something called Finkelstein's test. We're going to do it again. Actually, we won't do it on this. Yeah, we can do it on this hand. Demonstrating Finkelstein's test is where you put your thumb in your fist and then point it down. And when you do that, it just hurts too much to even do it, right?
No. Right now it's not hurting at all.
And then go down. Oh, wow. The camera didn't catch your face when you did that, but wow, that's...
It's still hurting right now.
Okay, so that's what we call positive Finkelstein's test. And what's happening there is you're stretching those tendons that go to the thumb and the wrist. There's a technique that is sometimes used for this where the skin of the wrist is numbed up before putting in the cortisone shot.
Oh, good.
Feeling the bone, and then I'm going a little bit dorsal to where that channel is that they're in. And I'm just going to numb up the skin over that area. Sorry, here's a shot. Did that hurt?
Didn't even feel it. Now I feel it.
You probably feel a sting from the medicine.
The sting, yeah.
Making sure we're not getting anything.
I'm a tough old bird, doctor, you know that.
A tough old bird? Well, I appreciate you being a tough old bird, but I like to think of myself as a good enough doctor that my patients don't have to be tough. I'm going to go in right here. You don't want to watch, do you?
No.
I'm okay with that. And I'm going in right where I feel the little dip.
Oh, hey, I don't even feel that. Oh, now I felt it.
Sorry. And I'm going into that point, and then I'm drawing back, making sure we're not in a vessel, and putting in. And I have to go where the medicine goes very easily. That's how you know you're not in a tendon. Now, one of the things you'll notice is I'm putting in a huge volume of medicine, and that's for good reason. A lot of times, people will give this shot with smaller amounts, and you can get away with that if you're so good that you always get exactly the right spot and bathe the tendon sheath in the cortisone. The other approach is to use lots of anesthetic mixed with the cortisone. And how is it now?
It was fine. Excuse me, it was fine until the beginning of the week when I started really using it. And I would say 95%.
Okay, let's do the Finkelstein's test where you put your thumb in your fist and go down like that. Anything?
No.
Oh, very good. And if I move the joint around?
It's fine.
Well, I would not suggest repeating the shot today.
Let's give it time.
But if it does come back, certainly at any time just call and we'll get you in and give you another shot.
Okay.
Hopefully you won't need to.
It's so much better than it was. Thank you.
Oh, you're very welcome. And thank you for joining us for this follow-up on Cheryl's wrist. And we'll be sure to keep you guys informed on that. If you have comments or questions, go ahead and put them in the comments section in the video below. And until next time, this is Cheryl and Dr. Vaughan telling you to stay in good health.
Thank you.